Good morning, ladies and gentlemen. I'm Robert Buckmire, the Program Director from the University of North Carolina Department of Otolaryngology. First, a couple comments. We opted to do this as a recorded introduction, just realizing that this year for the first time, our audience is spread across time zones and states, and we're hopeful that this allows you to review this information at your leisure before the interview and formulate some questions based on it. This morning we'll cover the two tracks that we have available in the match, and that includes the 5-year categorical spot as well as the 7-year T32 grant-funded research track. The PGY 1 year, which is shared between both tracks, is divided into 6 months, 6 months on otolaryngology and 6 months on off-service rotations. The otolaryngology portion is split 3 months as a head neck floor intern. This rotation is obviously very clinically busy. You're integral in terms of running the service and get a lot of hands-on experience in the hospital. The other 3 months are unique in that they are truly designed as an apprenticeship. The intern has a one-on-one relationship with a designated faculty member from each of these subspecialties noted, both in the clinic and the operating room over the course of a month, letting them gain some familiarity with clinical work as well as allowing the attending to get to know them well. The 6 months that are off service are spent with 1 month in the surgical intensive care unit, 1 month in anesthesia, and 2 months apiece in pediatric surgery and trauma surgery. The reason that we do this at our affiliated hospital of Wake Med is that these rotations are very clinically busy, hands-on, and very operative, as opposed to the more clerical tradition at university hospitals. The next comments I will make about the PGY 2, 3, and 4 years are about our current rotations. We are currently undergoing a relatively systemic restructuring that will primarily affect these years. So the PGY 2 structure is split into 2 6-month blocks, the first being at Wake Med. You work there with a general private practice that is busy. The focus of that rotation is really consult care, trauma care, and basic ENT. The other 6 months are spent in research here on the main campus of UNC. During that time, the residents are not involved in clinical care during the day, but are involved in the junior resident call pool. PGY 3 structure is rotation-based. 3 rotations here at UNC, Peds Otology, head neck oncology, and rhinology laryngology. The other 3 months spent at Wake Med, again, at a busy general private practice. PGY 4 year, now taking senior call, is based here at UNC in 3 clinical rotations, Peds Otology, head neck oncology, and a consolidated consult rotation in which the resident basically manages daytime consults, emergent airways, really is our face toward the entire hospital, and has a lot of interdisciplinary role and skill sets that have to be developed. The other 3 months are spent as the chief resident of the Wake Med rotation when they rotate out there. The chief year, PGY 5, is divided into 4 blocks, all here on the UNC campus. Each of the clinical rotations listed below, when you serve as the chief resident there, you do the most complex cases, as well as coordinating both inpatient and surgical care for the junior residents that are on your service. The administrative chief role is a significant role for coordinating all the didactics, really working as a liaison between the residents and the faculty as well as to the hospital. Additionally, you are the facial plastic and reconstructive surgery chief, and so get a significant clinical experience in the operating room during that time as well. The residency program restructuring that we are undergoing currently is directed based upon resident feedback, resident input. We have representatives from each clinical year in this planning committee. The onset of this is scheduled for July 2021. The goals are to optimize the clinical educational value of each patient exposure, and more specifically, that gives the residents some autonomy with regard to choosing clinic coverage that they feel is the most educational and suits their educational needs. We also seek to maximize the flexibility by, for the first time, bringing in some month-long elective rotations to allow residents to more carefully customize their clinical curriculum. The key changes from our previous rotation are basically the PGY 2s now will have 4 to 6 months of research during which we will actually add targeted clinical exposures here on the main UNC campus, which were previously missing. In the PGY 3-year and PGY 4-year, clinical elective rotations will be added, which allow folks to not only have a broad clinical exposure prior to having to make decisions about fellowship, but also let them basically backfill any clinical deficits they feel they have or get more experience in, especially that they may be more interested in during their PGY 4-year. Largely the PGY 1 and 5 structures will remain unchanged. The T32 research track is 2 full years of guarded research following the internship year. These residents are exempt from call responsibilities and all clinical responsibilities during this time. When they cycle back into the clinical realm, they come back in as PGY 2s at Wake Med for their clinical time, and then matriculate into their 3rd clinical year rather than doing more of the typical research that our PGY 2s would do. The scenario that this creates is that T32 residents are then done with their clinical time 6 months prior to their co-chiefs. This allows them to actually formulate a mini fellowship of sorts, either research or clinical, either in-house or with external rotations. So we've had people do wonderful rotations in facial plastics and skull-based surgery externally, as well as otology and head neck oncology research here during those times. There are many labs that the T32s have available to them. I want to point out that these are both interdepartmental as well as across all of UNC's campus. So there's a lot of opportunities that our folks have taken advantage of during their time here. For non-T32 residents, the PGY2s and other clinical residents have many opportunities to present at meetings. This is just a listing of the places that our residents have presented over the course of the last year. From an educational standpoint, we lead many courses here internally, both a temporal bone lab, of course. We have microvascular anastomosis lab, an airway foreign body lab. Many of these are multi-institutional, and they are essentially programmed for certain clinical years. There are educational courses across the country as well as at UNC that our residents attend on a regular basis. And lastly, I want to point out our multidisciplinary sim lab. This has been, I think, a real boon to the education of our residents. This is where we do our temporal bone labs, our foreign body airway labs, as well as both national and international courses. We are working very steadfastly to incorporate this as part of our routine didactic education with each of our subspecialty disciplines as well. I'm going to stop there. This is just a brief primer. You certainly have access to these slides going forward, and I look forward to answering any questions that you have regarding this curriculum.